Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the health officer for Shelby County Health Department. I'd like to just provide some updated information. First, data for today as of March 18th of 2021. A total number of confirmed and probable cases are 89,919. We've had 141 new cases as of yesterday. Our total deaths are 1,539. One thing that I want you to note here is that the number of deaths today reported is 141. This is higher than what was reported yesterday and the day before. We'll be monitoring this very closely to make sure that this isn't an upward trend. We're really focusing on these 7 and 14-day averages to determine what is the trend. As of date, we've given out 230,435 doses of vaccine, in which 162,017 were first dose and 68,418 second dose. And Director Sweat will give more information that relates to the vaccine. The other thing that I want to mention, as you may be aware, is yesterday we issued a new face mask directive number 5 and also health directive number 19. The health directive number 19 will become effective on the 20th. The face mask directive became effective yesterday, the 17th. And just want to highlight some of the differences that changes that may have occurred. One is that in the health directive number 19, we are increasing the number of people allowed to be seated at a table. So a family unit up to 8 people can be seated together. However, people together at that unit must be 6 feet away from someone at another table or unit. Likewise, we're allowing people to sit at the bar. 2 people can sit together. However, they must be separated at least 6 feet from other people at the bar or seated at a table in the restaurant. Using plexiglass to separate people is not an acceptable substitution. We also are allowing the hours of indoor dining in services to extend to 1 a.m. and giving an opportunity for people to finish up eating and paying for their meals to 1:30 a.m. The 2-hour limit for food services have been removed. Locations that serve beer and alcohol does not have to serve a customer food on each occasion. However, you must adhere to the laws of the state that requires that food is served in restaurants that serve alcohol. And we also are removing the requirement for maintaining and contact tracing records. We still ask that people still stay home if you're sick, if you have fever, any type of symptoms, you've been around someone who's tested positive, stay home. We're also requiring people to wear a face mask unless you are medically not able to tolerate one, or if you are eating and actually dining, take off your mask, of course, to eat, but once you finish, put it back on. It's very important that we adhere to these safety measures, the distancing and wearing the mask, so that we can continue to make the progress that we have made. There have been some reports that there are increased numbers in other states, some of the states that have relaxed their mask mandate, and so we don't want that to happen to us. So we want to open up, we want to do things, but we must take on personal responsibility to make sure that we are healthy and those who are around us are healthy. So it's very important that you adhere to these measures that we've outlined in the health directive. I encourage every citizen to visit our website, Shelby.community, and obtain a copy of the health directive so you will know what is expected of you. The other thing I'd like to mention is that this weekend, March 19th, Friday, March 19th, and Saturday, March 20th, the Health Department, in collaboration with Latino Memphis and Sukasa Family Ministries, will be offering free COVID-19 testing. And the locations are on Friday is at Latino Memphis, which is 6041 Mount Moriah Road, Memphis. And then the Saturday location is Sukasa Family Ministries, 1302 North Graham Street. And this is posted on our website, so you can go and actually get the information. But we're really encouraging our Latinx community to come get tested, also to get receive the vaccine when you are eligible and when offered. The last thing I want to comment on, and then I'll turn it over to Director Sweat. Many of you are already aware that the CDC and Tennessee Department of Health performed an assessment of the vaccine activities at the Health Department, and that the CDC released a report on the March 12th, 2021. And I just want to highlight again to the public the findings so that it can remove any concerns and fear that you may have. The findings in this report stated that the COVID vaccine was maintained at the appropriate temperature at Shelby County Health Department Pharmacy when it was being transported to the vaccination sites and at the vaccination sites. It went on to conclude that the totality of the evidence suggests that people received first and second doses from the Shelby County Health Department between 12/28/20 and 2/24/2021, that they received valid, stable doses of the vaccine, and revaccination is not recommended. And I just want to emphasize that because I want people to feel assured that the vaccine that you received was valid, stable, and subsequently should be effective. I also want to take this opportunity to thank all of the Shelby County employees and staff, including Dr. Judy Martin and Dr. Marilyn Bruce and Dr. Haushalter, for their efforts and their sacrifice. I want to thank those who were responsible for being in charge of the sites, those who were responsible for transporting the vaccine and for maintaining and making sure that the cold chain was maintained, and it was verified by CDC that it was. And so I want to just take publicly, acknowledge and thank all of you for the effort, for your sacrifice, for the professional work that you did. I know that we have taken some uncalled for, unjustified criticism in the media, but I want to tell you that this report, in my opinion, exonerates us, and it shows that we did our job, and you can hold your head up and not be ashamed. With that, I will turn it over to Director Sweat for additional comments and updates.
Good afternoon. I would just like to follow up with just an update on where we are with the vaccine process. As many of you know, last week, it's already been reported, we had administered almost around 33,000 vaccinations at the public pods, and that contributed greatly to the statewide numbers. I believe in Tennessee is 227,000, I believe is what Dr. Randolph reported. So we're making great progress in our community. But we still have a long way to go to get to that goal, to get at least 70% of our community vaccinated so that we can have that herd immunity and protection so that we can get back to full capacity of where we were before COVID-19 hit. After following up on last week, we had hoped to increase our capacity this week and administer even more doses of the vaccine. But many of you, as you know, we had to cancel yesterday due to the threat of severe weather. And that was, you know, for the public safety, as well as the people working at the vaccination sites who have to work outside under tents in the weather. And we just wanted it to be a safe day for everyone. So hopefully everyone stayed home and was safe yesterday, or if you did go to work, you had a safe day. But just a few things about your canceled appointments. If you had an appointment yesterday, you cannot just show up today or any day without an appointment. The only way to really successfully manage the process is to have appointments and to follow those guidelines that we've set out, to not show up more than an hour before your appointment, and to make sure that you actually have an appointment. So if you had an appointment and you haven't rescheduled yet, you need to reschedule. You can do that either at covid19.memphistn.gov, or you can call the 222 SHOT line. Now, what I believe a lot of you have taken advantage of that opportunity because our capacity has drastically increased for the rest of this week. We opened up some more opportunities for people that missed their appointments on yesterday to get appointments this week. So there's not many appointments left this week. We will be, as we have been the last several weeks, putting the new appointments for next week should go live by noon on Friday, and we will get those out as early as possible to make sure everyone has an opportunity to sign up or to re-sign up for another appointment. So as I said, we increased our capacity today, tomorrow, and Saturday at all the vaccination sites to try to absorb and keep our momentum going, getting the vaccinations in arms this week. So that's not without consequences. You may experience today, if you go to one of our sites, some extended wait times. Not in the hours like we had experienced before, but we've been really proud of keeping those wait times under 15 minutes the past few weeks. Expect delays today, but I think it'll be worth the delay if everyone who had an appointment this week to get a vaccination is able to get in there and get that vaccination and so that we keep everyone safe. So also, if we've opened a few appointments in the past for second dose Moderna, but we thought we had most of that group covered, but we're still getting some questions about second dose Moderna. If you need your second dose Moderna, there's several of the clinics and partners and some of the drugstore chains are receiving Moderna. You may be able to get an appointment there for your second dose. But if not, you can email us at covid19help@memphistn.gov. That's covid19help memphistn.gov. And if you will email us, leave us your information when you received your first dose, and we will try to make sure we connect you with either a facility or an appointment somewhere so that you can get your second dose Moderna. In addition, so as you know now, we have 5 mass vaccine sites that the city of Memphis and the Memphis Fire Department is sourcing through the state allocation. That is what I like to call is kind of the shotgun strategy. That is our way that we decided as a community. We get these mass sites out and get a lot of vaccine out really quickly to try to get our community herd immunity up. The second phase, I believe you heard Chief McGowan speak about, is we're pushing more vaccine out to our partners in the community, the clinics, the drugstores, the dialysis centers, places like that. There's several of our partners, over 50 partners are receiving allocations directly from the state now through the process of collaboration. So that was the second phase of being a little bit more targeted approach now towards specific places in the community. So now we need to start being a little more targeted towards communities where we are reviewing the data, and we've identified the 10 lowest zip codes for uptake of the vaccine, and we're targeting our pop-up pod strategy to those areas to get into those communities to really increase their capacity and their ability to come out and get the vaccine. One of the examples of this, we're having a pod this weekend at the Hickory Ridge Mall, and as I looked this morning, I believe 1,200 appointments were issued there, and I think almost all of them are gone for this weekend. So I think that's a great story that we reached out in that community, and people took advantage of those appointments. Last weekend in the Fraser community at the Fire Academy, we administered over 2,000 doses in that community. And we will continue to target areas working through a lot of other partners to get out into those communities, trusted partners in the community who want to help the faith-based communities and get the vaccine out to people who don't have the ability to get out and maybe travel to some of these mass vaccine sites. The second part of that is today we started the Memphis Fire Department Healthcare Navigators in partnership with several other agencies, including the Shelby County Division of Community Services, the Community Alliance for the Homeless, the Memphis Union Mission, Maritan, and others. We started our homebound and homeless work today, reaching out into that community and vaccinating people who cannot make it to the mass vaccine sites or have homeless individuals or people who are homebound. So we look to start reporting out on that. That is going to be a very labor-intensive work, reaching out into those communities, literally one person at a time, to get them, make sure that their protection is up to where it needs to be. But I believe it's going to be very labor-intensive, but it's very targeted and it's very needed in our community. And we look forward to being able to serve all of the members of our community and make sure we get the vaccine out to everyone. Everyone has an opportunity, remove all the barriers that we can, working with collaboration and partnerships, and to make sure that we are able to deliver the vaccine out in the community. And with that, I'll open it up to the media for questions.
April Thompson, WREG.
Can you hear me?
Yes.
Okay. I had a question about the sign-up genius. I know you all had to go back to it after the state system failed. I wanted to see if you could talk about what was it that the city had that did not fit with the state, because I think the city said it was not the state's fault, and the state said as much as well. And do you plan to make any changes in return to the state site? And I do have a follow-up.
Okay, thank you for that question, April. The state sign-up genius, it was the VRAS system. It worked. Part of the issue was it was a little complicated on the front end, and it was causing a lot of stress in the community, and there were some of the processes that we had put in place. It was going to cause a lot of change in some of the processes we already had working well. We had heard a lot of positive feedback with some of the changes and that we had done with Sign Up Genius prior to changing over. We also, we set up this helpline for people that are having anybody that's having trouble with Sign Up Genius. There's now, we have a process for responding to them and making sure that they get their appointments. So it wasn't that we couldn't make VRAS work. It was just that we had so much momentum going that we didn't want to stop that momentum. I come from a sports background, so I know what momentum can do in the middle of a game. It can really put a damper on the final results of the game. So we had a lot of momentum going with Sign Up Genius, and we didn't want to stop that momentum by staying switched over to a system that wasn't working for the community.
But, okay, and my follow-up is, but there was something that made you want to change from Sign Up when you first got on and took over from the county. What was that, and how can you assure that with more people going to be signing up, being eligible to get the vaccine, that you're going to be able to handle it with the Sign Up Genius?
Okay, that's a good question as well. So the main reason we went to the VRAS scheduler is because it was kind of tied to the state call center. And so both of them came on at the same time. The VRAS scheduler piece did not work for us very well, but we are staying with the state call center. So the 22 shots number, they're handling those calls for us now. And so far this week, I believe that switchover process has been pretty successful. So we stayed with the state call center vendor, but we had to switch back to VRAS just for our work processes. It just didn't work for us.
Brad Broders, Local 24.
Good afternoon. Happy birthday, Dr. Sweat. First question, I know you had mentioned about the community clinics. I know Director McGowan talked about the 14,000 doses going to those 50 or so community clinics and doctor's offices this week. How do you envision that supply in the weeks ahead, and in terms of the numbers of doses and maybe the numbers of community clinics growing, and just sort of the benefit of having doses go in those places?
Well, I think the benefit's to me seems pretty obvious that, people are used to going to their community clinics, to doctors that they know on a regular basis. And as they can grow their capacity, we start to normalize this much like the flu shot. But right now, the reason we needed the mass vaccine sites was to get as many doses out there into our community as fast as possible. I think we still want to do that, so we're going to keep the mass sites open. We increase the capacity to the clinics, the doctor's offices, and those where they can start administering vaccine, so that when our state allotment starts growing, that we build capacity in our system to be able to absorb that and to actually even build more and more momentum on that. So it's all part of really growing the system to handle when our allotment of vaccine starts to grow. We need to have the ability to absorb that.
Thanks. And as a follow-up, Director Sweat, I know Doug had mentioned on Tuesday about hoping to eventually add South Memphis and Orange Mound as the next targeted areas for the pop-up sites. Beyond the Hickory Hill and the Fraser site going on this weekend, do you anticipate any others in those South Memphis or Orange Mountain this weekend or in the coming weekends?
That's a great question. We'll be making an announcement about a partnership with Melrose High School for having a pop-up there within the very near future.
Kelly Roberts, WMC.
Hey there. Can you guys hear me okay?
Mm-hmm.
Great. I wanted to ask about next week's allotment. What does it look like? Do we anticipate more Johnson & Johnson? Will more of those eligible sites come online? If you could break that down.
So I didn't bring those exact numbers. I can tell you our allotment for next week was the same as this week. So we also were able to have that allocation meeting and push more out to the same partners who were receiving last week. So they'll receive a little bit more next week as we grow that capacity. For now, we will not be receiving any Johnson & Johnson next week. And I believe it will probably be about the first week of April before we will receive any Johnson & Johnson.
Okay, and my follow-up, I see that the city is looking for more volunteers at some of the public vaccination sites. I know currently people with medical training can immunize people. Has that always been the case? Was that the case during some of those days that the state was investigating in February? Can you explain, what people need to be able to vaccinate people?
Yeah, so the sign up, the instructions are who meets the qualification is probably in the sign-ups. I'm not looking at that now, but I think, we've been, the vaccination business has been going on since December, and it's very labor intensive, and a lot of people are volunteering their time. So as we move into the spring and everything, we just look to build that capacity. It's not just medical providers, but also just regular civilian people helping walk the lines, helping check people in. Even people who volunteer with best intentions, they get tired and they also have jobs and other things they have to attend to. So we just want to continue to build that capacity. So as we continue to receive more vaccine, we make sure we have the manpower to administer everything that we get in every shot. So no shot gets wasted. Everything goes in somebody's arm, and we get those out as timely as possible.
Daniel Connolly, Commercial Appeal.
Yes, hello. Thanks for taking the question. So regarding the new directive, what's the strategy behind the new directive and particularly eliminating contact tracing?
Thank you for that question. Let me be clear, we're not eliminating contact tracing. What we're eliminating is when you go to the restaurant and they ask you for your name, let's face it, many people are giving false names and false numbers, and that information is of very little use to us. We are continuing contact tracing. Matter of fact, we are focusing on isolating those individuals who test positive, especially if they have a variant strain. We are aggressively contacting these people, isolating them, and contact tracing those who are in households, congregate settings, or in workplace that we find a variant, or that we find that someone have tested positive and been exposed. But in terms of restaurants and other places where people have visited, and it may be over 7 days before we even know that a case were identified at that particular establishment, the contact tracing does us very little. If we're not able to identify people and communicate with them within 7 days, then the contact tracing becomes less valuable.
Thank you for that, Dr. Randolph. And regarding the CDC investigation, so my colleagues who have read the report tell me that it only covered the issue of cold chain stability and didn't address other issues like loss of vaccine, possible stolen vaccine, and children being vaccinated. So how does the CDC report exonerate the health department?
Well, it exonerates the health department in the fact that it showed that we maintain the proper temperature handling and storage of the vaccine. Therefore, there's not a need to vaccinate up to 47,000 people again. That had been thrown out as a possibility. And also, as it relates to these so-called stolen vaccines that have not been completely proven. Matter of fact, there's still some investigation there. And the vaccination of children did not occur as a result of a Shelby County nurse or staff person rendering that vaccine. And that is something that needs to be brought out and clarified. Those incidents occurred at sites that was not controlled and manned by the health department. It was the city of Memphis and UT Health Science Center that were over those particular locations. The Shelby County Health Department provided the vaccine and provided nurses that was there to make sure that the vaccine maintained the cold chain, and it did, and they did. And so we have gotten blamed for something that the health department staff and nurses did not do. And I think it is my duty as the health officer to bring that out, that it wasn't the health department, their staff, who committed those particular errors.
We are out of time. Are there any closing messages today from any panelists?
The message that I really want to get across to our citizens is that we have made progress. Numbers are going down, even though today there was higher than yesterday. But we've made progress. And I really want to encourage you to, let's continue the course. Let's continue wearing the mask. Let's continue the social distancing. And just because things are opening up, if I said before, because it's open doesn't necessarily mean you need to go. Because it's legally permitted doesn't mean that it's medically advisable. We're at a point where we all must take personal responsibility and do the things that would keep us healthy. Last thing I want to end on is that folk understand that we're in this together. This is a partnership. The city of Memphis and the Shelby County Health Department and all the citizens of Shelby County, we're in this together. And I want to applaud the efforts that the city of Memphis is doing in terms of their vaccination and their ability to decrease the amount of time that people are having to wait. We are in this together. We are partners, and we will work together. So I just leave you with that, and really encourage you to remain safe and stay the course.
Thanks, everyone. We'll see you back here next week.